Look at it, is a natural substance. It's a gel-like mass formed by platelets. Platelets are natural body substance with fibrin. That is the protein. And normally, blood clots are formed naturally to like plaster the artery walls or the veins if there is a damage, especially the arteries. If there is a damage or a crack, so to speak, in the artery wall. Arteries are the blood vessels that carry blood from the heart to your brain and other parts of the body. Sometimes we have damages or injuries in the body. So blood clots can form naturally to plaster it or to fill in these cracks, so to speak. So this is a natural clot. And when it forms naturally, then there's no problem at all. On the flip side, if blood clots form unnaturally or inappropriately, that is where the problem lies. And that's what we are going to talk about today. So if we look at it critically, let's understand what really blood is. You see, blood flows through the blood vessels from the heart through the arteries. It supplies blood to your brain, other organs up to the feet. And then your veins will bring the blood, back to the heart. And with you walking, when you walk, your muscles are active, it squeezes the flow. It enhances the flow of blood from your feet back to your heart. That's why walking is a perfect exercise for us. Anytime you walk, you squeeze blood back to your heart. If you don't walk and you do a lot of sitting, it means that there will be, in fact, stagnation of blood in your system, especially if you have a problem with the quality of blood and you have underlying health problems like diabetes or inflammatory condition, then unwanted clots can easily form. And normally, stagnation can also come. Those that you may travel very long haul. You may have a long haul flights, like maybe from London to New York or from London to Ghana, and there you may be sitting at just on one seat without any walking around, maybe in the aisles. That's why it's really important when you are traveling. You have to just walk in the aisle a bit and then sit down, and a bit while after maybe an hour or 1.5 hours, you walk in the aisle. When you do that, you stimulate circulation back to your heart. It's so important. But you see, our blood consists of red blood cells, which carries oxygen around in the body. It also contains white blood cells, which fight infections, which fight viruses and bacteria. And it also blood contains platelets. This is a natural substance that is part of the clotting process of your body. So clotting process is a natural process to help save you. But you see, unfortunately, as we're saying, if it's formed inappropriately, then of course, that's where the problems can come. We have also blood plasma, which contains fluid and chemical proteins important for bodily function. So it's really important to have all these materials in the body. You see, we have a term called thrombose. Thrombose is a medical term, means a blood clot. A blood clot, which normally, in fact, it can form anywhere in the body, especially in the veins. You see, we have what we call deep vein thrombosis, DVT. This is a name for a clot formed in one of the major veins, deeply seated in your body. It is most common for this to happen in your legs. It happens mostly in your leg, but it can also happen in your arm or in your pelvis or lungs or even in your brain. So that's a deep vein thrombosis. But you see, there's no way to know whether you have a blood clot without the medical guidance. That's why it's very important for us to know some of these symptoms. If you understand the symptoms and you understand how your body is working, without even a doctor coming in, you yourself, you know what is happening. But then it's possible to have a blood clot with no obvious symptoms. So here are the early warning signs and symptoms of blood clots in your leg, in your arm, in your heart, in your abdomen, and in your brain and in your lungs. We will have to know all about all these areas. All these areas may have different signs and symptoms. But then before we go to the blood clots in the leg and to get to know the symptoms, let me put the number on the platform. Maybe you have this problem or you don't have this problem at all. Give me a call. Calling outside the UK is plus 44 738 464 7300. Calling within the UK is 0738 464 7300. The second number is plus 44 745 988 9152. Calling within the UK is 0745 988 9152. You can give me a call and God will bless you for any inner disease, and don't give the devil a foothold. Now let's come here. Blood clot in the leg or in the arm. Let's look at the symptom. When blood clots in the leg, depending on the size of the clot, if it's a small clot, normally you see swelling in the calf. In the calf, you see swelling. And that calf area will be painful and tender and warm. And then the color, that area, the color may change. Normally in the white folks, it will be reddish, discoloration. But in the people of color, it will be, the color will change to maybe a little bit dark. If you have a dark skin, to be darker. So once again, small clots in the leg will be swelling in the calf, pain in the calf, tenderness, warm sensation, and discoloration. It means a bit darker color. But then when the clot is big in your leg, then definitely there will be swelling from the feet up to your thigh area. The whole leg will be swollen. And then you will have all the symptoms: pain, tenderness, sensation, and discoloration as well. So that is a clot in the leg. But now let's come to a clot in the heart. When you have a clot in the heart, of course, we call that heart attack. Here, it doesn't give you any option at all. It's not too common for clots to form in the heart, but it happens. It happens if your arteries are not free and they're narrow and stiff and you don't have good blood quality. Definitely, there will be a problem with clots. And normally when clots form in the heart, it causes chest pain, which we know. It hurts you and you feel so much heaviness on your chest. And then you feel lightheaded, you feel dizzy, you'll be short of breath, and you'll be sweating because your heart will be overworking, trying to meet the need of the body. That is oxygenation. Because if there's a clot in the blood, the oxygenation is poor. Because oxygenation is poor, your heart will try to beat, to work, and as it's working, you'll also be sweating. But let me remind you, also if you're a woman, or you are diabetic, or you are elderly, let's say 65 and more, normally these symptoms I've mentioned, if there's a clot in your heart, you may not even experience this heaviness. You may experience indigestion and nausea. Indigestion and nausea. Or you may experience lightheaded, you may be dizzy, short of breath, sweating, and in addition, you may have digestive issues as well. You may feel like vomiting. That is in the diabetic patient, or elderly, or women. So these three groups, they may have specific additional symptoms, which you have to take note. Normally, it doesn't affect men. That is indigestion or nausea. And of course, this pain, which you may feel in your heart, may radiate or it may spread to your arm, to your jaw, and in your back. All right. So that is the clot in the heart. But now let's come to a clot in the abdomen. When there's a clot in the abdomen, then this one is very clear. There will be severe abdominal pain and swelling of the abdomen. But this symptom could mimic the symptom of stomach virus or food poisoning. If someone is poisoned, the person may have also abdominal swelling and severe pain, but also blood clot in the artery supplying blood in your abdomen. You may feel the same as well. So it may be difficult to distinguish it if it is food poisoning or if it is really clot in the artery supplying blood in your abdomen. But this can be a problem. But now let's come to clot to the artery towards the brain. We have a special artery that supply blood to the brain. That is called the carotid artery. When this artery is narrowed and stiff, and there's a clot, unwanted clot, or clots that are formed inappropriately, then this clot may swim in the blood and get stuck. So they block the flow of blood to the brain. Now, if the person is not helped within 4 or 5 minutes, then there is stroke. But nobody can realize this. Normally, this type of stroke is called TIA. That is transit ischemic attack, or we call that mini stroke. It's a stroke that, in fact, it may not be too severe, but the symptoms are the following. It's a loss of speech. At the beginning, the person may not be able to pronounce certain words, or maybe a name that that person might pronounce easily. So loss of speech and loss of vision. And there's a profound dizziness. And there's a weakness or loss of sensation in one side of the body. And so if that person is experiencing it, you see that, please, you may have to help the person by calling for emergency. Normally, there's a fascia drooping. That's one half of the face. That's called the fascia drooping. And then the arm weakness. So you may ask the person to raise both arms. If the person can raise both arms, then you have to know that there's something wrong. But please put all the symptoms together. It's being speech, loss of vision, dizziness, and weakness in one half of the body, and inability to raise both arms. If you see this, then of course it's time to call that emergency number. It's not time to do anything but call for emergency. Now, let's go on. Clots that are formed in the lungs. We call that pulmonary embolism. A blood clot that travels to your lungs is called pulmonary embolism. Sometimes we call it PE. When you go to hospital, that's what they name it, PE. Normally, we have an artery that supplies blood to your lungs. When this artery is also plugging, and it means it's narrowed and stiff, and there's unwanted clot that swims towards that area and blocks that area, then of course you may experience what they call the pulmonary embolism, PE. What are the symptoms? That person may suddenly feel shortness of breath. That isn't caused by exercise. You are not exercising. You are not doing anything demanding. You're there. Suddenly, you are short of breath. And then you have chest pain. And then your heart will be beating very quickly. That is a rapid heart rate. And then there's a real difficulty in breathing. And there's a cough. You'll be coughing. And then, in fact, to some extent, you may cough up blood. So once again, listen carefully. Sudden shortness of breath, sudden. And then so it means that that person may be experiencing breathing problem. And there's a chest pain. And there's a palpitation or rapid heart rate. Breathing problems. Coughing up blood. put all the symptoms together, and then you know that it's pulmonary embolism, clots that are formed towards your lungs. Now, at this point, let's come to the causes. What actually leads to clotting? Unwanted clots. I've told you initially, we have natural formation of clots. The natural formation, if your body forms the clots naturally, maybe because of an injury or damage within the body, this clot is necessary, is used for plastering. You see, when you see cracks in the building, you get some material to fill the cracks. You get a filler to fill the cracks. So the natural clotting, formation of clot, is a natural filler. So to speak, it's a natural filler. And normally it's formed with the platelets and fibrin. Fibrin is a protein. It combines that, and then it goes to the injury site. So normally when you have an injury, you see, your body will not leave you to bleed to death. So there's a natural formation of this. Platelets will combine with this fibrin, and then will try to seal off this injury area, or the site of injury, to stop bleeding. So the same thing that is formed when there's a damage within your artery. This type of clotting is not dangerous. It is safe. It is natural. But unwanted clotting is what we're talking about here. Now, how do we have unwanted clots in the body? The first condition here, or the first cause, is what is called atrial fibrillation. And what is atrial fibrillation? This is about heart problem. You see, the heart contains, or is made up of 4 chambers. We have the 2 upper chambers and then 2 down chambers. Naturally, the 2 upper chambers should beat in harmony and supply blood to the lower chambers to get blood within the body, right? But if the 2 upper chambers are not beating in harmony with the 2 lower chambers, then we have this atrial fibrillation. This is the condition. We call that atrial fibrillation. I mean, your heart is not beating in harmony. In this case, clots form easily. Clots form easily in the body. Your heart will not pump well, and clots can form in the heart as well. Now, another condition is when a person might have experienced or has experienced heart attack. When part of the heart muscles become injured in the heart attack condition, it can't contract normally. It can't, the heart has to contract and relax, contract. That's how it beats. It's like your fist. You fist up, you open up. That's how the heart is. But after heart attack, normally that contraction can be a problem. So it means that your heart cannot beat effectively or efficiently. In this case, it can cause or lead to a pool or stagnation of blood that can lead to clotting formation in the system. You see, if your heart, even if you don't have heart attack, and your heart is not working well, it's not efficient, then of course, definitely, there could be blood pool. Your blood will pool. If your blood pools, it means that there's a stagnation of blood in your body, especially in your feet. And when that happens, normally people that experience swelling of the feet, it means that if your heart is not working well, and then you start having swelling in the feet, it means that the fluid in the blood may be getting into the tissues of your feet, and that's why you see the swelling of feet. So swelling of feet is quite typical of inefficient heart, or heart which is not working well. Sometimes it's, of course, it could be the kidneys. In fact, kidneys function is number 1, but number 2 is a heart. Sometimes it's a heart, sometimes it's a kidney. So these two normally could be the cause or the factors for feet swelling. There are other factors too, but not too common, like the liver, if it's not working well, or maybe inflammation of the veins in your feet. If the walls of the veins are inflamed, blood cannot easily go back to the heart. So that can also lead to that, but that's not too common. But most common is your heart and then the kidneys. And the third common problem is inflammation of the veins in your feet. So blood cannot easily go back to the heart, and there's a blood pool in the feet, which can lead naturally to clot formation. So you see, today we've heard that clot formation we have natural one, which is not dangerous. It is necessary because that's what the body uses to fill in any injury or to plaster any cracks in your arteries and your veins, especially your arteries. And if there's injury in your body as a result of heart problems like atrial fibrillation or heart attack or any weakness of your heart, it can lead to inappropriate formation of clots. And also, if the wall of the veins in your leg is inflamed or is weak, blood cannot easily go back to the heart, and that can be a problem. So today, you see, we have educated ourselves. We've empowered ourselves through knowledge. And please, go and visit us on the YouTube. Put in Dr. James dash natural link, and you see a lot of presentations so that you don't miss any presentation, please. And then also visit on Facebook. Please go on the YouTube and press the like button, subscribe, please, and share and support this program, because we are all working together. We are all in this together to support each other, and God will richly bless you. Don't miss this program anytime, Thursdays and Sundays between 8 and 9 p.m. So I'll see you on Sunday, God willing, with a fresh topic.